Assalamualaikum doctors. In this video I am discussing about a history that is Guillain-Barre syndrome, GBS. So Guillain-Barre syndrome, there is weakness, neuropathy, Campylobacter jejuni is the main organisms. The chief complaints is like that. The main complaint is unable to walk, or difficulty or unable to walk, or poo problem. Like a few days back there is any gastroenteritis or recent vaccine taken. After that unable to walk, this present. So history, first we are analyzing the chief complaints, onset, course and duration, what make it worse and what make it better. Is it preceded by any illness? Is it unilateral or bilateral? Is it the first time or recurrent, especially if asymmetrical migraine and moya? Is the upper limb is affected or not? Do you feel his legs stiff or floppy? Is his foot is dropped? Can he feel pins and needle? Any diurnal variations? Any swallowing problem? Any jaw stiffness? Ask about the motor level. Can he crawl? Can he sit? Ask about the sensory level. If I touch his little finger, can he feel? Then we'll go up till we reach the level. Then general, does he look like you and his daddy? Does he have any chronic illness, any other concerns? FWASL, fever, weight, activity, sleep. So again, Guillain-Barre syndrome, chief complaints, unable to walk. We'll analyzing the chief complaint. First of all, onset, course and durations. What make it worse and what make it better? Is it preceded by any illness? Is it unilateral or bilateral? Is it the first time or recurrent, especially if asymmetrical migraine and moya? Is the upper limb is affected or not? Do you feel his legs stiff or floppy? Is his foot is dropped? Can he feel pins and needle? Any diurnal variations? Any swallowing problem? Any jaw stiffness? Ask about the motor level. Can he crawl? Can he sit? Ask about the sensory level. If I touched his little finger, can he feel? Then we will go up till we reach the level. General question we are asking, does he look like you and his daddy? Does he have any chronic illness, any other concerns, fever, weight, activity and sleep? After that we are going to the systemic review, one by one. CNS, signs of increased intracranial pressures, abnormal movement, facial asymmetry, fears, eye deviations, abnormal behavior, any concern regarding his vision, hearing or speech, any change in his head size, bugs in the brain or shunt, anxiety about the tummy pain, tummy size, poo nature, and if he had loose motions before, ask about the poo control. So very important, poo history, poo nature, and if he had any loose motions before, ask about the poo control. CVS, about the awareness of heartbeats, chest pain, how many pillows, anybody edema, eyelids, lower limb and tummy. Chest, about any chest pain, breathing problems, cough and cold, bugs and snoring sound. Urinary, about the pee control, pee color, amount, painful peeing and blood pressure measured. MSK, about the skin spots and describe. Skin discoloration, joint pain, joint swelling, bone aches, anybody lumps, hair or nail changes. Endocrine, about the blood glucose level. Hematology, pallor, bleeding and recurrent bug. Then past history as usual, 5T IOA. Very important question is ask any trauma, because unable to walk is our chief complaint. So any trauma to the head, legs, back and neck. Recent and traveling history, contact to COVID, any previous admissions, blood transfusion, surgery, these are. Parental history, any event in pregnancy, jelly scan result, newborn screening, NIQ admissions. Puberty, about started menses, is it regular, boyfriend, OCP, protections. Vaccination, very important, is his vaccination is up to date, polio, any recent vaccine, parents received COVID vaccine. Allergy, nutrition on a special diet, type of food, amount and growth chart. Development, important if child is less than 2 years, in detail and growth chart. Family, similar conditions, sudden death in the family. Then social, school, psychological impact. So this is Guillain-Barre syndrome. How can we take? Now the differential diagnosis we can keep from unable to walk are, first of all, acute flaccid paralysis. Okay, acute flaccid paralysis, then any infection like polio, ascending, diphtheria, botulism, descending manner. Post-infectious and autoimmune like GBS, transverse myelitis, sensory level, due to infection and triggers and autoimmune demyelination of nerves. Trauma, acute cerebellar ataxia. So remember the DD of Guillain-Barre syndrome are transverse myelitis, trauma, tumor, poliomyelitis, then acute virus cerebellar ataxia. Acute cerebellar ataxia. These are the DD. Diphtheria, botulism, polio also we can keep. Acute flaccid paralysis. This is all about GBS history. Thank you.